guys, hi, good morning. So today we'll be discussing this topic, the historical and the contemporary nursing practice. So you'll know that we will just discuss the history of nursing, the nursing leaders, how has nursing evolved in the long run, and then the modification with regards to the nursing. And as you can observe, guys, the first 8 pages of the book or actually contains those information. But if you can observe that remaining 4 pages, guys, nadyo dito ang importante yun. So you really have to observe and you really have to take note of those information because you will going to use that in a long run, specifically when you take your board examination in the future. Okay, now let's proceed. Historical perspective, there is actually a dramatic change in response to the societal needs and influences. Of course, there's dramatic change because as you can observe way back then in the past, diba ang technology nila dili pa yung ana ka kumbaga high paced, unlike sa ato ang generation today nga atong technology is evolving na siya every now and then. So nursing at the same time correspond to the changes. And then women's roles. So from the beginning of time, women have cared for infants and children. That's said to be the roots. So usually they don't have power way back then. So women tend to be a plain housewife, caring with their children, with their husband. So wala gid sila power in politics, wala sila power sa lain. And even nursing at the past, dili siya kaing anak ka prestigious unlike today because nursing just like pag nursing ka daw ka sa una, it's just like you're a caregiver o what. So, baba kayong standard sa nursing sa una compared to our present generation. Okay, now, sa religion naman, it is Christian value of love thy neighbor as thyself and Christ parable of Good Samaritan Act. So, this Good Samaritan Act, actually guys, we are currently using US book. So, US ang ato ang libro na ginagamit. So we don't have that Filipino version of that Fundamentals of Nursing book. So since then, we are using Kuzir and Herbs. So that's why Good Samaritan, guys, is just like, for example, in the US, kung mutabang kag isa ka tao, like you're na-aksidente, then you are just a passerby, and then nitabang ka anang nga tao, then whatever happened, kung mamatay ba na siya or dili, you are being protected with this Good Samaritan Act dito sa US. Pero dito sa Pilipinas, wala tayo Good Samaritan Act. Meaning, if you're just a passerby, you're a nurse, and then you opt to help that patient from that vehicular accident, kung mamatay na siya, you are liable to that. Because we don't have that Good Samaritan Act here in the Philippines. So always remember, we are using US-based textbook. Okay? So that's it. So during the 3rd and the 4th centuries, several wealthy matrons of the Roman Empire called Fabiola used their wealth to provide houses of care and healing to the poor, sick, and homeless. So this is like way back then, adyo gihapoy mga maayo nga tao, like they help the poor, homeless individuals, like gigamit nila ilang wealth just to offer support and help to those people. And then, this is just mga information lang ni siya, guys. Proceeds so the formation of several orders of knights, like Knights of Saint John of Jerusalem, then or shall we say, the Knights of Hospitallers, the Teutonic Knights, and the Knights of Saint Lazarus. So there are 3 knights, okay? There are 3. They provided nursing care to the sick and injured comrades. Knights of Saint Lazarus dedicated themselves to the care of people with leprosy. Leprosy, guys, madiscuss na ninyo when you go along with your second year. Okay, mag-second year, madiscuss nyo. It's just a communicable disorder which primarily caused by a bacteria. Causative agent would be Mycobacterium leprae. I am not sure with that. But you will be, madiscuss na siya when you reach second year, like public health nursing, like communicable health nursing. And then it's like leprosy will affect your nerves in the extremities, but will also affect your skin. So sila ato ang nagatabang kani sila nga Knights of St. Lazarus. Syphilis is a sexually transmitted infection, another chronic skin condition. So imagine how dedicated they are. Kasi even if you compare those moments at the present, kinsa may maayo nga kinsa tao nga motabang katong sa tao nga naingani nga problem. So it's like they are being praised due to their hard works and dedication that time. Okay, during the medieval times, election brothers organized care for the victims of Black Plague, 14th century in Germany. So in 1836, Theodor Flieder opened a small hospital in Kaiserswerth, Germany, where, can you still remember, where Florence Nightingale has its first training. So dito ba sa Kaiserswerth, Germany nag-train si Nightingale. So mo to yung first training school. So don't forget that. So during war, Crimean War, can you still remember Crimean War? We already discussed this. Crimean War is where the scenario wherein Florence Nightingale helped those sick and wounded soldiers. So it's from year 1854 to 1856. So Florence Nightingale was asked by Sir Sidney Herbert to recruit female nurses. So American Civil War 1861 to 1865. So nana diri ang mga information na pasok. Harriet Tubman and Sojourner Truth provide care and safety to slaves fleeing to the north on the Underground Railroad. So there's nothing to discuss with that. And Mother Bickerdike and Clara Barton, searched the battlefields to give care to injured soldiers. And Dorothea Dex is provided nursing care during the Civil War, and she was the Union superintendent of female nurses. So that's Dex. Societal attitude naman. So how does people see nurses, or how those people see nursing as a profession way back then? Before the mid-1800s, women's place was in the home and no respectable career. Societal attitudes about nursing during this period are reflected in the writings of Charles Dickens. His book, Martin Chuzzlewit, 1896, reflected his attitude towards nurses through his character, Sari Gamp. So this Sari Gamp, guys, always remember that this Sari Gamp is the negative image of the nurses in the early 1800s. So, more negative mga personality and characters ang ginaportray ani. Though, in contrast, the guardian angel or angel of mercy arose in the later part of the 19th century. It is the positive image of nurses during Crimean War. So, diba, during Crimean War, during this century, nana si Nightingale, tabang siya soldiers. So, that's the time nga na kumaga na reverse tong negative image, Sari Gamp, negative image of nurses. So, it was actually replaced by guardian angel or angel of mercy, which is connotates the positive image of nurses. Another thing is doctor's handmaiden image evolved when women had yet to obtain the right to vote, where scientific knowledge was viewed as a male domain. So way back then, syempre, aware na ta sa history, and even in our history way back then, high school, we are discussed na we don't have the right to vote. Women don't have the right to vote in the past. So it's just like recently, in this generation, where women and men have an equal opportunities when it comes to politics and a lot of specialty. So equal na. So now let's discuss nursing leaders from 1820 to 1910. That was Nightingale era, where Crimean War, she was considered a lady with a lump. So don't forget that way back then when I asked somebody from your group sa TFN, why is that Nightingale was considered as the lady with a lump? And wala siya naka-answer. So I was actually sad knowing the fact na wa siya kabalo. So please make sure she was considered as the lady with a lump because of her greatest contribution during the Crimean War. She was carrying a lump, and during the night, nagkatuyok siya sa mga sick and wounded soldiers to give care, to give comfort, to give medication or what. Okay? So the first scientist theorist for her works on notes on nursing, what it is and what it is not. Sorry. It is not. It's not like tea, so it is not. So this is the first book, as far as you can remember. This is the first book being published by Nightingale. What it is and what it is not. So Clara Barton naman is a school teacher, volunteered as a nurse during American Civil War, established American Red Cross. So here in the Philippines, as sort of recall, sa Philippines, that's the reason why Philippine Red Cross was actually established here in the Philippines. It's just like nakuha sila o theme or nakuha sila og idea from American Red Cross, which basically Clara Barton established first. Linda Richards naman is the first trained nurse in America, so known for introducing nurses' notes and doctor's order. Okay. Are you familiar with nurses' notes? Nurses' notes, guys, is where you, as a nurse in the future, will going to document all the happenings with regards to the patient, all the intervention, all the objective and the subjective data you assessed upon assessing the patient. You have to take down it sa imong nurses' notes. Doctor's order naman, dira kana siya na form. Dira mag-order ang doktor all the medication, all the possible specific procedure and diagnostic treatments. So dito i-order sa doktor ang iyang mga, kumbaga dito niya isulat. Okay? So initiated the practice of wearing uniform, and that is Linda Richards. Mary Mahoney, the first African professional nurse, she promoted equal opportunities and recognized her contribution in interracial relationships. So that's it. It's the first African American professional nurse, and that was Mary Mahoney. Lillian Waldman is the founder of Public Health Nursing. Together with Mary Brewster, they offered trained nursing service to the poor in New York slums. Lavinia Eldak is a feminist, prolific writer, political activist, and a friend of WILD. She was part of the protest movements for women's rights. Women have the right to vote. So, yeah. Diri na sila nagsugod-sugod og assert og ilahang mga opinions in this period. Margaret Higgins Sanger naman, imprisoned for operating first birth control information clinic. So, napriso siya because sa una sa ilahang during that period, birth control is actually prohibited. So that's why siguro nakita ni Higgins Sanger there's something wrong with the population and she should stop that. So nag-create siya first birth control, and that was the reason why she was imprisoned. So she was the founder of the Planned Parenthood. Next is Mary Breckinridge, established the Frontier Nursing Service, started in one of the first midwifery training school in US. Okay. Main in nursing, during the World War II, it is believed that women are for nursing while men are for combat. Diba? So, men is for nursing and men are for combat. But Luther Chrisman is one of the founders of the American Assembly for Men in Nursing. So, ayahang goal ni Luther Chrisman is to increase the enrollment of men in nursing programs. So, that was the reason why nursing now, you can take whether you are a male or a female, you have the right to choose if gusto ninyo mag-nursing. That's because of Luther Chrisman. Men did experience discrimination not allowed in a maternity clinical experience. Even up to the present, guys, I'll tell you, like kung lalaki ka, magkuha kag case, magpaanak mo, di ba na usually, even here in the Philippines, na usually awkwardness, dili comfortable ang patient, nga nailalaki sa ilaha nga walang anak sila. It's just like that. So you really have to face that consequences as a nursing student, and even if you are a nurse in the future. Nursing education. Okay, so let's focus on the nursing education. Always remember, guys, that we are using the US book. So the education sa US actually is not the same here in the Philippines. So just bear with that. Okay, the current nursing curricula emphasize critical thinking and supporting knowledge to health promotion, health maintenance, and health restoration. So in US, guys, there are two types of entry nurse. RN, registered nurse, or an LPN, a licensed practical nurse, or licensed vocational nurse. So there are two entries. But here in the Philippines, there are only one at this moment sa atong generation. You have to pass BSN. You have to be an RN, okay? So, an RN complete diploma nursing program. So once you graduate, you either take the licensure examination to become an RN or continue into specialty roles such as nurse practitioner or educator. Okay? So, yeah. LVN naman, complete the specified coursework. So, naalang kay, kumbaga, naay kay himuon. Like, mag-training ka, mag-undergo kag training like 8 to 12 months perhaps, and then you will be certified as LVN or LPN. But you are under the supervision of the registered nurse. In US, guys, NCLEX RN, all nurses must take the exam. For you to be qualified to work as a nurse in the America, you have to pass your NCLEX. Here in the Philippines, as per my experience, if you are the nurse from the Philippines, you will undergo a lot of scrutinization with regards to your academic records. Like for me, my related learning exposure was actually scrutinized. Kinahanglan nila ana. And then after all the scrutinization and after all the verification nga na-verify jud nga registered nurse ka diri sa Pilipinas, you really have to take NCLEX. Then an NCLEX will be only taken in Manila, and you have to take it for once, and then if you pass it, then you will be an NCLEX passer or a USRN, and that will be the best time for you to practice nurse in the America. Okay? So all nurses must take the exam. It is a regulatory model called mutual recognition that allows for multi-state licensure under one license. So, based on my experience, guys, I have this experience that I'm going to share with you with regards to this mutual recognition. Sa America kasi, guys, if you're a passer, like ako, passer ko sa Texas. Kasi every state, unlike there sa Pilipinas, kung mupasa ka nurse, you're already a nurse. You can work wherever asa diri sa Pilipinas. But in America, naaray certain state, kasi every state naa sila sariling regulatory body. Kumbaga naa sila PRC nilang sarili. Unlike diri sa Pilipinas nga isa lang PRC. Dito dahi. So ako ay ang state na kong gikuha is Texas. So, ang Texas kasi, why I choose Texas, Board of Nursing? It's because Texas naay daghan nga state, kumbaga, naay daghan state nga mutually recognized. So, daghan state nga kanang mapwede nimo matrabuhan, like 23 states. I'm not sure with that how many states. So that's why they recognize that specific state. So that's why when I was given a chance to choose what state akong pilion sa America, I choose Texas. Because you can work the different states without taking the exam again. Kasi every state has its own policies and guidelines. So yeah, I'm just giving you guys an idea. Basin gusto mo take an exam sa inyong future purposes. So states that enter into this agreement share referred to as compact states. So matong pasabot sa inyo ha. So ang Texas naa sila mutual recognition sa uban na state. So same sila og policies and guidelines. So bisag asa ka dito na state basta belong lang atong mutually recognized sa Texas, pwede ka maka-work dito as a nurse. But of course, if you want to work in Illinois, which is not actually included sa Texas, you can apply for a verification or ask for their policies and the guidelines. That's it. Okay? Aside from passing the licensure examination, the candidate must complete the verification in a prescribed course of study in nursing. So that's what I mean. So even though you're graduated in the US, they need to gather or verify your data. Specifically or especially when you graduated here in the Philippines. So that is first world country. So usually stricto kay sila mga ana basta mga first world country. You are just third world country, so yeah, we have to expect na daghan kay sila kuti with regards to ato ang mga requirements. So the accreditation commission for the nursing sorry guys. The accreditation of commission for the education in nursing, the approval body of the state board, the approval study of board. So, kani siya ang approval state board ito, ng Accreditation Commission for Education in Nursing, which is primarily called as ACEN. So, there are types of educational program, LVN or LPN. So, these programs generally last 9 to 12 months, classroom and clinical. So, after graduating, after the 9 to 12 months, that candidate will take the NCLEX PN or the practical nurse or vocational nurse to obtain licensure as a PN or VN. The practical nurse or the vocational nurse, same lang na sila guys. Work under the supervision of a registered nurse. Okay? So, if you are an LPN, you will work under the liability of the nurse or the registered nurse. And your function, provide basic direct technical care to clients. So, yeah, that's your function. That's your scope as an LPN. But here in the Philippines, we just have nursing attendant, nurse, and the midwife. Nursing attendant, guys, is the liability of the nurse. So, under sa supervision sa nursing attendant, under sa supervision sa nurse ang mga nursing attendant. That's it. And then, registered nursing program, there are 3 major routes to eligibility for RN licensure if you are a US citizen. So, yeah, if you are a US citizen or dito ka, even though you are a Filipino and then you migrated to US, and then these are the following routes that you are going to take for you to be eligible for RN licensure. First would be diploma programs. So, these diploma programs with little formal classroom instruction directly provide care to clients. It's like a 3-year diploma program. So, today's diploma programs are hospital-based that provide rich clinical experience for nursing students. So, sa Amerika, kung under kag diploma programs, it's like you are staying in the hospital. It's like, naramo dito just to, to be well-equipped with what's happening in the environment, with the actual setting, with the actual scenario. Yes, that's it. And then the second one is associate degree programs. So these programs take place in community college. It started after Mildred Montag published her doctoral dissertation. The study proposed a 2-year educational program for RNs in the community college as a solution to acute shortage of nurses during World War II, called as a nursing technician or a bedside nurse, scope broader than a practical nurse, lesser than a professional nurse. So, it means that higher gihapon ang mga professional nurse. So, they were being called for that purpose to augment nurses during the World War II. So, we will not focus onto that because it's just like the scenario in America. So, we are now in the Philippines, so we have to focus onto that. So, in the Philippines, we only have nursing attendant. And if you want to be a nurse, you just have to graduate with Baccalaureate degree with 4 years degree in nursing with no failing grades at all. Because I know, once you have failing grades at least 2 times in nursing, you are not allowed to enroll. That's what I remember way back then. Pag nakadalawang bagsak ka na, di ka na pwedeng mag-enroll na nursing. You are advised for transfer or either mag-shift ka laing course. So that's it. The next one would be Baccalaureate degree program. So University of Minnesota, the first school of nursing in university setting. So consisted of the 3-year diploma programs plus 2 years of liberal art education. So the usual degree awarded is DSM. It's like 5, but here in the Philippines just 4. So nurses who hold baccalaureate degree experiences more autonomy. Autonomy, guys, is, excuse me, it's your right to decide. Okay, it's like you know how to decide because you are aware of what's your responsibility. You are allowed to perform a particular decision, and of course career advancement. So that's the positive side of graduating as a baccalaureate degree. So that's it. And then graduate nursing programs, there are requirements in the US. RN ka dapat. So kasi may mga nursing programs like gusto ka mag-masteral sa US, gusto ka mag-doctorate. So mauni siya ang mga requirements. You need to be an RN, a baccalaureate degree from approved college, evidence of scholastic ability, satisfactory achievement on a standard qualifying exam, letters of recommendation from supervisors and colleagues. So it's not easy for you to enroll in master's degree in the US. They will really give you a lot of requirements. But of course, I also have some of, not my friend, but some of my the one who inspired me finished her master's degree in America. And actually way back then she was also planning to pursue her doctorate pero na-stop. So master's degree lang siya. But of course, pwede ka mag-master's dito once you pass this requirements, as long as porsigido lang ka. Because she finished her BSN degree here in the Philippines. So posible gyapon ka maka-masters dito. Master's degree programs prepare nurses to work in variety roles, including clinical nurse specialist, nurse practitioner, nurse anesthetist. Okay, that's your stepping ladder, kumbaga, if you want to pursue a higher profession in the US. Doctoral degrees, doctoral programs naman ay 2 primary doctoral degrees in nursing, PhD and DNP, or the Doctor of Nursing Practice. So there are 2 PhD and DNP. Now, continuing education. Okay, this is it. So I really want you to absorb this topic because you will be using this one when you reach 4th year, 3rd year, and even when you will going to take your board examination. Okay. Continuing education refers to a formalized experiences designed to enhance the knowledge or skills of practicing professionals. Responsibility of a practicing nurse. Okay? Always remember there are 2 education: continuing education and in-service education. This continuing education is a responsibility of a practicing nurse. Meaning, if you are a nurse, nag-work ka sa hospital, it's your responsibility to enhance your skills, to to gather more information. So you will attend seminars, you will attend workshops related to nursing, of course, and that's your responsibility as a nurse. So here in the Philippines, we do have, if you will going to renew your license, you need to present CPD units. Those CPD units, ma-earning mo na siya, guys, once you attend seminars like basic life support or advanced cardiac life support. So once mag-attend mo ana ng mga workshops, you will be given a corresponding CPD units. Mao na ang gamiton nyo pang renew. So mao na ang ginatawag na continuing education. That is your responsibility as a nurse. So the purpose of that is the constant update and growth are essential to keep abreast of technological changes. So we all know, guys, na daghan kay changes karon because grabe nag-evolve ang technology. So we really have to be aware of that, and we have to practice ourselves. We really have to make sure nga nakasabay ta, because technology actually nara sa atong mga palibot, specifically when you're working in a a prestige hospital, specifically in the America, hindi there sa Pilipinas, sa US, kasi grabe ka advance silang technology. So kailangan nimo mo sabay. So it designed to inform nurses of new techniques. The first one, inform nurses and then help nurses to attain expertise in specialized area and see information essential to nursing practice. It's like feeding you with so much information as a nurse. Now, the next one would be in-service education. The first one is continuing, which is the responsibility of a nurse. Next would be in-service education. It is a specific type of continuing education program that is offered by an employer. So, okay, sabot ninyo. So, kaning in-service education, like you are working in a hospital, your employer is responsible, to send you to a specific workshop, specific, like for example, na incubator, na bag-o na machine sa inyong ward, na incubator for example. Of course, dili man kay makabalo dayon mo, diba? So they were going to send you for workshops and for training and so that's in service education. It means offered by an employer. So always remember that. Upgrade the knowledge or skills of employees. This is what we call in-service programs offered by the employer to inform the staff about a new piece of equipment or a new surgical procedure. So, same na sila. It means it's offered by an employer. Balik na siya sa continuing kasi responsibility ni mo na siya as a nurse. So, hope you learn something. Do not forget that too. Do not be confused because this information are actually important din sa inyo. Okay, now, the definition of nursing. So, we already know that every theory has its own definition of nursing. Nightingale naman, active utilizing the environment of the patient to assist him or in her recovery. So, Henderson, the unique function of a nurse is to assist the individual, sick or well, in the performance of those activities contributing to health or its recovery. ANA is American Nurses Association. Here in the Philippines, we have PNA, or the Philippine Nurses Association. So, sa Amerika man ilang definition sa 1973, direct, goal-oriented, and adaptable to the needs of the individual, the family, and community during health and illness. But somehow, during the evolvement process, they changed their definition unto this one. 1980, American Nurses Association defined nursing as the diagnosis and treatment of human responses to actual or potential health problems. So, what do you mean actual problems? Na-admit inyong pasyente, nakita di mo siya nga upon assessment, you've noticed na pag BP nimo taas ang blood pressure, so increased BP, maon na iyahang actual problem. Yung potential problem, taas iyang BP, nalipong siya, potential problem would be, pwede siya mahulog. So, that's it. Risk for fall. Yeah. So, as a nurse, you have to identify those one, the actual and potential problems. So, gets? Actual is what you see the moment you've seen the patient. Potential naman is because of this problem that might lead to that another problem naman. Okay? Now, recipients of nursing. Sometimes, it's S. It's called consumer, patient, or client. Now, i-discuss na to kung asa gyud ang mas mas gwapo na term na ginagamit ani. So, consumer is an individual or a group of people or a community that uses a service or a commodity. So, people who use healthcare services. Nag-evolve po. So, the second one is patient. Patient, usually mga ginagamit din nato, waiting for or undergoing medical treatment, comes from the Latin word meaning to bear or to suffer. So, pangit ang connotation. So, the word patient implies passive acceptance. When we say passive, it means dawat to dawat lang pasyente without cooperating. So, always remember the patient and the nurse, when the rest with the healthcare team, must collaborate with each other. And the best term would be client. So, do not use patient, use client. A person who engaged the advice or a services of another who is qualified to provide the service. represent the receiver of healthcare as a collaborators in the care. So kita as a nurse or as a doctor, ang mga doktor nato ginatabangan na nato ang pasyente. But the main concern here is our client. So just like we are collaborating with each other. In this book, client is the preferred term. So always remember that. So that would be all. I actually separated the other topics so that dili na kayo ma-bored kasi I think naka 30 minutes na ta and you have to rest your brain. Giseparate na ko ang another part sa chapter 1 para maka-relax mo at the same time makainom mo tubig or what. So just make sure that you listen this lecture, specifically in the later part of the chapter 1, this one, because it's really important for you guys. So that would be all. Thanks for listening, and we will go into continue this lecture.